This video will be of the skull. We're going to use 3 different models to demonstrate the different parts of the skull. We're going to use the entire skull here. We're going to use the mandible of a different skull here. And we're also going to use this skull to show you interior portions of the skull and also portions of the skull that are superior to the mandible but are inferior on the major part of the skull. So the very first thing we're going to do is we're going to go over the bones themselves, then we'll return to the bones for the different markings that may be found on the bones. The exception to this is going to be the foramina, which we will cover separately. So the first 4 major bones are known as the cranial bones. Those 4 bones are going to be the frontal bone here, the parietal bones here and here, the occipital bone here, and the occipital bone is going to go all the way around like this. And the temporal bone, which can be found on the side of the skull, around here. Okay. Other than the cranial bones, we've got a lot of other bones on the skull, and those bones are pretty much known as the facial bones. And in those facial bones, we're also going to have as well as the facial bones, we're also going to have interior bones. Okay, so those facial bones are going to be the paired nasal bones here and here. You're also going to see the paired maxillas, which are larger bones, which are right here. These make up the majority of the face. So this will be the left maxilla. This will be the right maxilla. Adjoining the maxilla and joining to the temporal bone, we've got the zygomatic bone. And this is basically where your cheekbones come from. They're going to be right here. This is going to be the lacrimal bone. This is where your tear ducts are going to be. Interior to this, we can see part of the ethmoid bone. We'll see that in more detail when we look at the interior of the skull. And we also have the sphenoid bone here, which we will see in more detail when we look at, again, the interior of the skull. The jawbone here is called the mandible. Few other bones that we've got are the vomer, which is the nasal, which is the bony portion of the nasal septum that's located right here. Okay, taking a look at the underside of the skull, we can see the paired palatine bones here and here. And we can also see the ethmoid and the sphenoid bones in a lot more detail. The ethmoid bone here and the sphenoid bone all the way around here. Okay, so we're back to the skull here. We're going to take a look at the markings of the frontal bone. And basically you've got the glabella, which is this sort of flattened area in between the supraorbital ridges. So here's the glabella. I know that your list has the supraorbital foramina, but this is actually one of the weaknesses of using models instead of real bones. The supraorbital foramina really don't show up well on most models, so I'm not going to require you to learn that. The parietal bones don't really have any markings that we're going to learn. The occipital bone only has one marking that we're really going to learn here, and this is actually going to be on the underside of the skull. So why don't I use this other model to show these features to you. So here's going to be the occipital bone here. You'll notice a large foramen in the middle. We're going to come back to this. But these rounded protuberances here are called the occipital condyles, and these are actually going to make contact with the C1 vertebra, which is also known as the atlas. So that's the markings of the occipital bone that I'm going to show you for now. The temporal bone, as we're going to see, is a good deal more complex, and I'm going to shift from this model. I just wanted to show you this model so that you can see that the temporal bone only proceeds slightly above where this cut for the skull cap is. We're going to use the skull that doesn't have the skull cap on it to take a closer look at the temporal bone. So taking a look at the temporal bone, we're going to see a number of markings on here. The first that we're going to take a look at is the styloid process. Now you can see this sort of as a background. Here it's this small pointed process here. And let me get more of a zoom in on it. You can see this actually right here. This is a styloid process. Looks kind of like a stylus, and that's exactly what people were thinking when they actually named this. We've got a couple more processes to talk about. The first is the zygomatic process, which is right here. Now I want to get a little bit more of a close-up so that you can see the suture that's in between these two bones, or the division between these two bones. And so the temporal bone is going to be right here. The zygomatic bone is going to be right here. So the zygomatic process is the process of the temporal bone that reaches out to touch the zygomatic bone. So this zygomatic process is named after the bone that it reaches out and touches. The third process is the mastoid process. This is a large, blunt, rounded process coming again from the temporal bone. The next thing that we've got are a couple of what are called portions of the temporal bone. One is interior and one is actually exterior. So the petrous portion of the temporal bone is right here. These are these large raised ridges that you can see on the interior of the skull. And basically the petrous portion holds all of the tubes of the inner ear. So this is where you're going to find your vestibule. This is where you're going to find your semicircular canals. This is where you're going to find your cochlea. So the organs of balance and hearing are actually contained in the petrous portion here. The other portion of the temporal bone is called the squamous portion. You may remember from the tissue lab that the squamous portion, or that squamous, simple squamous epithelium, is composed of flattened cells. And so it should come as no surprise that the squamous portion of the temporal bone is right here. So you can see that it's a flattened portion. Think of the portion of bone that you rub when you have a headache. Okay, the last marking on the bone that we're going to take a look at is called a fossa. This is a shallow depression in the bone, and this is called the mandibular fossa after the bone with which it articulates. And so if you're looking at this, you can see the mandibular fossa right here, and this is where a portion of the mandible that we'll take a look at later actually sockets into the bone here and forms part of the TMJ, or temporomandibular joint. At this angle, you can actually see the occipital condyles here of the occipital bone a little bit more clearly. So I'll kind of emphasize those one more time, the occipital condyles. So the next couple of bones I'm going to show you are on the interior of the skull with the ethmoid and the sphenoid bones. So this is the ethmoid bone. Let me get a little bit more of a close-up so you can see that more clearly. Now there's a small ridge that projects up from the ethmoid bone. This is called the crista galli. So that's that particular term that you have to learn. The other markings that you'll have to learn are actually on the sphenoid bone, which is this sort of butterfly-shaped bone right here. You can see the outlines of it. It looks kind of like a butterfly. Now, as you might expect, it's got a couple of names that sound kind of like a butterfly: lesser wings and greater wings. So these are the lesser wings here and here. The greater wings are here and here. Finally, there's a portion called the sella turcica. This literally translates from the Latin into saddle of the Turk. So apparently, early anatomists thought that this looked like a saddle. So this actually provides a bony housing for the pituitary gland. Next up, we're going to turn our attention to a couple of facial bones, the zygomatic and the maxilla. So with the zygomatic, one of the main features is something you've already seen before, and that's this temporal process which reaches out and touches the zygomatic bone. So this is going to be the temporal process of the zygomatic bone. The other bone that we're going to take a look at is the maxilla. And with the maxilla, the things that I want to emphasize here that are not foramina are the alveolar process, which is right here. So the alveolar process actually serves as the process where you have sockets for teeth. So the maxilla makes up a substantial portion of the mouth. In fact, it makes up the superior portion of the oral cavity, along with the palatine bone. So this larger portion here is called the palatine process. And this palatine process is going to form the majority of the hard palate. As you can see here, a little bit of the hard palate is actually formed by the palatine bone. So we're going to have a sudden screen change here. We're going to take a look at the mandible. And with the mandible, we've got a number of different portions here. It's one of the larger bones. I think it's the largest bone in terms of mass of the entire skull. So the main portion is called the body. And this portion that extends up in this direction is called the ramus. So the sort of border between them is the mandibular angle, which is right here. Now, the portions that actually socket this into the maxilla are the mandibular condyle here. This is the mandibular notch. So you can see this sort of U-shaped notch right here. This is the coronoid process. Okay. As with the maxilla, we've got sockets for teeth. And so these are going to be called, this is also going to be called the alveolar process. So there is an alveolar process with both the maxilla and the mandible. This rounded portion here is actually called the mandibular symphysis. So this is sort of the rounded portion of the bone where the two halves of the bone come together. Now, since we've got the jaw here, I'm going to go over the types of teeth. And so what we're going to do is just take a look at one half of one jaw. And so what I'm showing you here can be multiplied by 4. So on each side of each half of each jaw, we've got 2 incisors, 1 canine, 2 premolars, and 3 molars. So this individual actually kept their wisdom teeth. Okay. So again, 2 incisors, 8 overall, 1 canine here, 4 overall, 2 premolars, 8 overall, 3 molars, 12 overall, total of 32 teeth. And this is something that's called the dental formula, which is the incisors, canines, premolars, molars. It's going to be 2, 1, 2, 3. And one of the interesting things about this dental formula is that it is conserved in every single hominid fossil that's been found. So that's not just us. It's also Neanderthals and Australopithecines. So apparently for omnivores, this is a really, really good tooth type combination. So here's another sudden bone change. And what we're going to be doing now is we're going to be looking at the foramina. And so foramina are rounded holes in a bone that are usually entry points for nerves and blood vessels. So we've got a number of these foramina to look at, and also a couple of fissures here to look at. So we're going to start actually literally from the top. So this is the superior and the inferior orbital fissures. So they're within the eye cavity, and these, you're going to see these right here. Next up, we've got the infraorbital foramen, which is going to be right here. And we've got the mental foramen, which is right here. Now, there is another foramen associated with the mandible. And what we're going to have to do with this is we're going to have to turn the mandible around and look at the inside of the mandible. So let me grab our separate mandible so that you can actually see this. And you're going to see this right here, but inferior to the mandibular notch. This is going to be the mandibular foramen. Okay, so here's another sudden view change for you. I apologize if this is a little bit disorienting. So what I wanted to show you with this view are 5 different foramens. And so we're going to start with the optic foramen here. We're going to proceed from anterior to posterior. So here's the optic foramen. This is the foramen rotundum here. The jugular foramen can be found just posterior to the petrous portion of the temporal bone. So that's going to be here. The hypoglossal canal is going to be found lateral right here, lateral here to the largest of the foramina, which is the foramen magnum. Now, something that's very interesting about the foramen magnum is that it is an indicator of bipedalism. And so if you have just a portion of a skull, as long as you've got the occipital bone, you can see the angle at which the spinal cord and the vertebral column come away from the skull. And that can tell you whether this particular organism was actually bipedal or a quadruped. So the foramen magnum is an indicator of bipedalism. And that's the way that if a paleontologist finds a portion of a skull in the desert, that just from that portion of the skull, that paleontologist would be able to tell you that a particular organism was bipedal. It's again, the angle of the foramen magnum. Now, let's see. This needs to come into focus. It doesn't look like it's quite in focus. So give me just a moment. All right, there we go. So the last 3 foramina that I'm going to show you are the foramen ovale, which is here, the foramen lacerum, which is here, and the carotid canal, which is, let me get a little bit of a closer up look on that. So that's going to be this canal here. And what I want you to notice is that the foramen ovale, the foramen lacerum, and the carotid canal kind of make a triangle. And this is something that you can see in the foramina handout that I provided on eLearn. Okay, so that is the foramina, or those are the foramina, excuse me, and that's actually going to kind of close things down for the skull. And so what I'm going to do is I'm going to pause the recording and I'm going to come back with the 3 types of vertebrae and we'll continue with the axial skeleton. So I apologize, we do have to return to the skull for just a moment to show you the sutures, which are the joints that actually join the cranial bones. So there are going to be 4 of these major sutures. The first one is going to be the coronal suture, which joins the frontal bone to the parietal bones. The second is the sagittal suture, which connects the 2 parietal bones. The third is the lambdoidal suture, which actually joins the parietal bones to the occipital bone. And the fourth is the squamosal suture, which joins the temporal bone to the parietal and the occipital bones. So that's going to be right here. The other thing that I wanted to show you with respect to skulls is actually a fetal skull. And so this is the fetal skull right here. And it's usually at this point where I make jokes about the guy with the crazy hair on the History Channel and says everything is aliens. And this is not an alien. This is simply just a fetal skull. The thing that I wanted to show you about the fetal skull is this. This is called the fontanelle. It's a soft spot. You're going to see a fontanelles also in the occipital region and also in the temporal region, which this model doesn't show very well at all. But these fontanelles, which are going to be again here and here and back here, are going to basically allow this to fit through this. So you've got to do some fairly intensive squeezing to get through here. And what these fontanelles are going to do is they're going to allow the fetal skull to deform and make its way through the birth canal. So now we've come to the end of talking about the skull. Okay, after our next sudden change, you can see that we're looking at vertebrae here. And so what I'm going to do is go over sort of the general parts of the vertebrae. Let me see if I can get a zoom in here. No pun intended. And show you the different parts of the vertebrae that are common to actually all vertebrae. And so we're just going to use the, I think the thoracic vertebrae to show these different parts. So this is the body, this large portion right here. And if you were to look at this, then you're going to see the vertebra here, anterior and posterior. These are going to be lateral. And then this, of course, is going to be the medial portion here. And so this is anterior. And what these are going to do is in between these surfaces, you're going to find intervertebral discs, which are made up of fibrocartilage. And so the general portions of the vertebrae are the body. Again, the bodies are separated by fibrocartilage. This portion that joins the rest of the vertebra to the body is called the pedicel. These are the transverse processes here and here. This is the spinous process here. And the structures that join the spinous process to the rest of the vertebrae are is the lamina that's going to be here and here. So basically, if I were demonstrating this with my hands, I would say if the general sort of overall shape of the vertebra is like this, then this portion would be the lamina and the portion where my palms are would be the pedicel. And so the spinous process would be sticking up from in between my fingers here, and then the transverse processes would be sticking up from my knuckles here, so if that helps. And then the body would be a large portion of them right here beneath my palms. So I kind of use that as a model for the vertebrae. Okay, so one more time, let's take a look at this. And again, we'll get a tighter in view. And so body, pedicel, transverse processes, lamina, spinous process. Now, there are a couple of other things that I want to show you, which are surfaces that the vertebrae articulate against each other with. Those are going to be the superior articular facets, which are going to be here and here. And so the superior ones will face inferiorly, and the inferior ones, which are here and here will actually face anteriorly. So these are superior facing towards the back or posteriorly. These are inferior facing towards the front or anteriorly. And the way that these are going to socket together is going to be basically, let me see if I can find a comparable sized thoracic vertebra here. So I've got another one that's part of another set here. And so you can see right here how these articular facets are going to socket together like this and make basically one long running string of vertebrae. Okay, so you heard me refer to this as a thoracic vertebra. And how is it that I can tell thoracic, which is right here, from lumbar, which is right here, from cervical, which is right here? Well, there are two questions that if you ask yourself these questions, then you're going to be able to distinguish these three different vertebrae from one another. So this is a cervical vertebra. And the key to knowing that a vertebra is a cervical vertebra, the keys are right here and right here. These are called and I'm sorry, I should have mentioned this before. This is, excuse me for just a moment. I apologize for that. I had to sneeze. So hard to concentrate when you do that. So this is the vertebral foramen, and this is something that is present in all vertebrae as well. I should have mentioned that prior to this. So here and here are the transverse foramina. So the transverse foramina are actually present in the transverse processes, which would be here, basically, and here. So does it have transverse foramina? If yes, it is a cervical vertebra. And if no, it is one of the other types. Now, the other sort of cheap way that you can tell that this is a cervical vertebra, turn it like this. And this looks like the sloth from Ice Age, I think. And so if it's smiling at you, if it's a happy vertebra, then this is a cervical vertebra. Okay, so question one, does it have transverse processes? If yes, it is a cervical vertebra. If no, it is one of these other two, the thoracic or the lumbar vertebra. Now, the thoracic vertebrae are vertebrae that actually articulate with ribs. So wherever your ribs actually come out of your spinal column, they're going to actually rub against these vertebrae and they're going to leave distinct scars or distinct marks. And so do you have articulation points with ribs like you see here on the side of the body, and particularly here on the side of the body, also on the anterior side of the transverse process? Here, you'll see little grooves here, and you'll also see a little groove here where the rib has kind of come back around, out and around like this. So it'll come all the way back around, okay? And so if you see articulation points with ribs, then that's going to be a transverse vertebra. And if we actually get a real vertebra, which is something that Tazewell doesn't have, that I'm a little bit, I'm working with Morristown materials right now, something that Tazewell doesn't have, but Morristown does, real vertebrae, I get a little bit jealous of that. You can see this clear point of articulation with the rib right here on the transverse process. And let's see if we can get a little bit closer view on the body. Yeah, there is a sort of a scar point right here where there's an articulation point with a rib. Okay, the third type of vertebrae is a lumbar vertebrae. And basically you get this by process of elimination. So does it have transverse foramina? If yes, it's cervical. If no, does it have articulation points for ribs? If yes, it's thoracic. If no, lumbar. So 2 questions, 3 types of vertebrae. Okay, now there is one other thing that I want to show you about this. The top 2 or the 2 superior most cervical vertebrae actually have got specialized names, and these are called the atlas and the axis. And so the atlas is named is C1. So by convention, vertebrae are named from superior to inferior. So you've got 7 cervical vertebrae, 12 thoracic, 5 lumbar, 4 sacral, and then there's the coccyx. And I'll show you the sacrum and the coccyx in just a little bit. So these are C1 and C2, the top 2 cervical vertebrae. And so this is the top one, the atlas. And so this one actually doesn't have a body. okay? A portion of the axis, which is C2, actually will sort of socket in right here with the axis, I'm sorry, with the atlas. It'll socket in with the atlas and form a joint that I think is a little bit more flexible than most of the joints in the skeleton. And this keeps you from having a dislocation, or it helps prevent common dislocations of the cervical vertebra against where it attaches with the occipital bone. So again, atlas, and you can remember T for atlas, the top of the spinal column, and axis, and then axis is sort of a fulcrum, and that is the axis is the point around which the atlas rotates. So that's how it gets its name. And that is it for the vertebrae. And I'm gonna pause the recording, and when I come back, we are going to take a look at a couple more things. We're going to take a look at the ribs, and we're also going to take a look at the hyoid and the sternum. Okay, so the last thing that we're going to do is actually take our iPad out of the clamp here, and we're going to take a look at the standing skeleton. So I apologize if this recording is a little bit shaky, but now I'm doing this handheld. And what we're going to do is we're going to take a look at the sternum first, and then we're going to take a look at the ribs, and then we're going to take a look at the hyoid bone. So before I do anything else, I want to tell you, they got a decent sense of humor in Morristown. Our skeleton is apparently paying attention to the pandemic. So it's got a mask on, it's got gloves on. So proper PPE for study in the A&P lab. Okay, so this is the sternum here. The sternum has got three sections to it. The manubrium, which is up here, and the manubrium is what actually articulates with the clavicle or collarbone. So this is going to be the manubrium here. The body is right here, and then the xiphoid process is right here. And the story that I always tell about the xiphoid process is that this is my very favorite bone in my body. And the reason why is because when I had heart trouble, I actually got an angioplasty, and they kind of temporarily cleared up the heart trouble that way, or cleared my coronary arteries that way. The doctors did tell me that if they had known how bad it was in there, they would have just cracked me open and done bypass surgery on me. And I was very thankful that they didn't. But the reason why this xiphoid process is my very favorite bone or in my body is when they crack you open to do bypass surgery or something like that, the first thing they do is they just shave this off and throw it in the trash can. So the fact that I've still got it means that I never had to go through open heart surgery, and I'm very grateful for that. Okay, so again, manubrium, body here. Xiphoid process is this last little thing right here. Okay, so if we go around to the posterior portion of the skeleton here, then I want to show you where the thoracic vertebrae are and where they articulate with these ribs. So we're going to kind of go down the spinal column here, and as we go down the spinal column, we're going to work our way all the way down to the sacrum, which is right here. So this is a series of fused bones. So there are technically 4 sacral vertebrae, because you can somewhat make out 4 spinous processes if you've got a little bit of imagination. And then down here, finally, we've got the coccyx, which is also known as the tailbone. Okay, so that really does wrap up the entire vertebral column. And now we're going to turn our attention back around to the ribs. So if there are 3 types of ribs, ribs that are called true ribs, false ribs, and floating ribs. And we're going to start at the top here and work our way down. So I want you to notice that this rib has a direct cartilage connection with the sternum. So does this one, so does this one, so does this one, and so forth and so on. And all of the ones that have their own cartilage connection are known as true ribs. So here's another one. This one has its own connection. This one has its own connection. Okay. But then after this one, you've got some others down here that aren't joining into the sternum directly. They're joining into the cartilage itself that's up here. Okay. These are going to be known as the false ribs. Okay. So these sometimes get called vertebrosternal, having a direct connection with the sternum, vertebrochondral, having a connection with cartilage, and that's what chondral means. Okay. And then the third type of rib, which is called a floating rib, has no connection with the sternum at all. So these 2 ribs here and here are going to be the floating ribs. So basically you've got true, false, and floating, and that's pretty much all that you're going to have to remember of those ribs. I'm not going to make you memorize vertebrosternal, vertebrochondral, and vertebral. Okay, so the last thing we're going to take a look at is the hyoid bone. And so we're actually going to have to kind of unmask this guy. So this is something that wouldn't be considered polite in society nowadays. So if tucked up under here, if I can get the correct view on this, this is the hyoid bone right here. And you'll notice that it's kind of loose, and that's very appropriate because this bone is actually the only bone in the body that does not articulate or move against another bone. And so the hyoid actually forms a reinforcement for your larynx. And it serves as a muscle attachment for the muscles that move the larynx up and down. And if you place your hands or your thumb and your forefinger on your larynx and swallow, you'll be able to feel your larynx move up and down. And you can also feel it moving up and down as you speak. And this can actually change the pitch of your voice for things like emphasis. And also in some languages, pitch is actually a part of the language. So that's going to be the hyoid bone. And I believe that this is the last portion of the axial skeleton that we have. So what I'll do here is I'll get a little bit of a zoom out and our skeleton in the mask. Let me adjust this back down here. We don't want to make him blind. So got to cover the nose though. So place that mask properly. We're going to zoom out, and this is our skeleton. And with that, we are going to end this recording. The next recording will be the appendicular skeleton.